Okay, welcome back again. Biashara Tuesdays on air. Do I say doctor? Do I call you doctor? Austin Omondi, or did I just say Austin Omondi right up? Dr. Austin Omondi.
I think I deserve it.
After years and years of toiling,
yeah.
You do deserve it. Do you have an issue, by the way, with people who don't refer you to as doctor?
No, I believe I am a humble man, and I would still like to be called Austin Omondi.
Right.
It's still my name, so I love it.
Right.
If you like to add doctor, that's okay.
Even better.
Even better.
All right. Maybe in the future, HSC and all of those other additions to people's names. But welcome to the show, brother.
Thank you so much for having me, Richard, and thank you so much for the guys watching us at home. Thank you so much.
All right. An introduction to yourself. Saying Dr. Austin Omondi for the people who might not know you. Let's get to know about you and where you get to practice medicine at the moment.
Thank you so much, Richard, for having me once again. My name is Dr. Austin Omondi. I'm an alumni of Egerton University, and formerly from Alliance High School, I must say. So I'm currently a medical officer intern stationed at Kiambu Level 5 Hospital. Yet to be posted, but we love it. Thank you so much, Richard.
But we love it. We'll get to that in a moment. You plus 4,000 others. But the conversation we are starting with this morning is modern technology. When back then, a few years back, I was involved in this little project that you can look up online called MedBit, and we were trying to integrate technology within the healthcare in institutions and also delivery. How can modern technology be used in efficient delivery of healthcare?
Thank you so much, Richard. So I remember a few years back there was a project of MedBit, which was an online platform where medics would get to interact with patients. Basically, so if you wanted to meet a doctor online, you would just log into MedBit. For example, you're looking for an ophthalmologist, you'd look for an ophthalmologist, let's say in Nakuru or in Nairobi, and it will give you a few options for the same. So in that way, technology has really brought the doctor closer to the patient. You don't have to travel miles and miles for you to meet a doctor, basically. And that falls under the bracket of telemedicine. So in telemedicine, I think that it's really opened up the world, basically. You can get to interact with a doctor even as far as the United States. You can do online medical consultations with the doctor, and that has really basically made the world a smaller place. So if you also look at technology right now, we have even wearable devices. So guys have smartwatches and Apple watches and whatnot. So you get to exercise, you get to keep fit, you check your pulse rate, check your heart rate, check the number of steps, and also the calories that you're actually burning. So in that way, you get to, technology basically has made like healthcare closer to you. If you want to go a bit technical, you have the aspect of medical imaging. So a few years back, we only had things like X-rays, and you know how hectic it was. But now, currently, we have things like the ultrasounds and the CT scans of the world and the MRIs, and even those ones are paling right now compared to the PET scans. So right now, tests that would take like 3 days, 4 days, even a whole week right now are taking like a few hours.
Right.
Back in the day, people had to walk with sheets. I don't know whether you remember the X-ray sheets that you used to walk around with a film and whatnot.
Right, when you're going for a chest checkup, you have to carry this huge envelope.
Amazing. Nowadays, you don't have to do that. When you take an X-ray or a CT scan, they send it directly to your phone and your WhatsApp. From there onwards, it really reduces the paper load. Patients has forgotten an X-ray at home. So technology has really been a wonderful thing particularly for healthcare.
Right. That's such positive news, including some of those technology advances that you've mentioned there, from wearables. I did see that the Apple Watch can now even call your emergency contacts if you have a heart attack, or if you suddenly have if you fall in your house. It gives you a bit of time to see if you had a heart attack, or maybe you're just sleeping, and then calls your emergency contacts.
Amazing.
Right? That's a really good ways, or innovative ways, in which technology is helping healthcare be delivered or localized to an individual level. But as we speak of the positives, there are definitely challenges. As I mentioned back then, even convincing the older generation of doctors to adopt some of these technologies. Anasema, hey, hiyo mambo ni mambo ya social media, mambo ya vijana hiyo sitaki. What are some of these challenges in implementing new technologies that you've seen from your end?
Also, thank you so much. So the first thing that I'd like to talk about is like the acceptability. As it's common, when something is new, people don't understand it. So there's normally a difficulty in the uptake. That is the first thing. But I think with time, with the westernization of the country and modernization of the world, people have been more willing to accept like newer technology, for example, telemedicine, you know, like talking to doctors online, even the AI part of medicine and talking to bots, people have been more welcoming of that. The next aspect of that has always been, as the usual problems, cost. Some of this technology is really expensive. For example, the positron emitting tomography, that is the PET scan. It's a really
how did you call it?
The positron emitting tomography.
Hey,
PET scan.
I last saw positrons in physics.
Yeah, so it uses the same concept.
Okay.
So it's really ultra modern, better than the CT scan, better than the MRI. But now the biggest challenge for this kind of technology has been always cost. It is very expensive. I think at the moment we only have 2 in the country. So you can imagine the kind of wait list that you actually have. You might have the money to pay for these scans, but you have to wait a really long time. So I think those have been the major problems, like the cost and the acceptability of the technology. But I think as time goes by and as the country is getting more money, more resources, I think the government will be able to invest the same.
Right.
Yeah.
Right. I'm going to get to you also now on how we can make healthcare affordable in the Republic, because I think that's a really big challenge. But as we are still on technology, social media, you have a very huge following on social media. If you can access that at the very moment, I think the last time I checked it was about 16,000 followers here on Twitter. You know, couple of retweets every day. Once you speak something, you know, people are excited to share it with their following as well. How do you package yourself on social media as a doctor? Let's begin from just that packaging.
Thank you so much. So my name on social media is Dr. Austin Omondi, famously Japrado. So social media I really started small. I started back when I was in school and had a few mentors like Dr. Rain and also someone called Ogera. So these have been medics who have always been at the forefront, like online medical education, you know, and that's something that I'm very passionate about, especially mental health issues right now. They're a big conundrum in the country, so I was very passionate about that. So I decided what is the best way for me to get to impact very many people at the same time. So there's a common saying that says even the best doctor can only treat one patient at a time, but through online and through advocacy we can get to treat hundreds of patients or even the whole country at a go. So that was like my initial mantra, and that has kept me going. So what has really helped me in social media basically is the way I package myself is I try to speak about what I'm sure of, what I know is true. I try to be kind on social media. Sometimes you get people who will try and insult you.
Who are aggressive.
Very aggressive. You see how you tackle them. And sometimes also just ignore sometimes the detractors and focus on the positive aspects of it.
Okay.
So that has always been
your way to package yourself. Let me just maybe before you go on there, you know, you've mentioned of aggressive people, or maybe people who might be having opinions that you're maybe get you angry sometimes. Do you rebuttal? Do you show that side of you, or do you keep that off the interwebs?
So usually another mantra that I have for social media use is I try to use social media as if my future boss is reading
your tweets.
My tweets, and also as if my current boss is going to use it to give me an upgrade at my place of work. So you try to really be respectful, and also realize that there are so many keyboard warriors nowadays. So and it will really hurt you. It will not hurt you by keeping quiet. So that has really helped me, particularly dealing with I would call them haters and the detractors.
do you chime in on tea? When it's Tea Sunday and there's a very hot conversation, or do you have to keep your brand image intact?
Only if the tea is medical related. If it's medical related, sometimes, like there was a tweet the other day about someone talking about the mothers who undergo CSS to be less of mothers. So I felt like that one it's someone who had a huge following, over 100,000 people. So I felt like it was very important for me, as much as it is tea and the trending topic, I feel like it's positive for me to chime in. Or if it's something like suicide related or things like poisoning, like you saw the other one, the DJ Brownskin issue.
Right.
I really had to chime in, and I got almost 500,000 engagements on that tweet.
Right.
So I talked about the safety measures that someone can take when someone takes poisons and that. So if it's tea and it's medically related and I can come in, I love it.
You will be on it.
I will be on it.
I'm looking at some of the tweets that you do here. Sometimes it's also not something entirely medical, or maybe what people would expect, directions on how to use drugs or something like that. For example, this one that's currently at 1,000 likes and 107,000 views here. Here's what to do if someone is electrocuted. This other information that you also pick here. How do you get to do your research and still continue with your path as a medic?
Amazing. So they normally say that once you become a medic, you've signed up yourself for like perpetual reading. So I actually take time sometimes looking at the current issues. For example, people have been having issues with this, the electrical heaters particularly. People have had like massive accidents from it. So you take time, you read about the like what to do, for example, in this kind of scenarios. And then once you read it and integrate it, and then you put it in the simplest possible language that the layman can understand, because I don't want to put like medical jargons there and do CPR. Someone might not know what CPR is, so like just put it in a very simple language that someone can understand. And day-to-day usage. So many guys even DM me and call me on my number saying like, some of this information I've bookmarked it and that really helped. For example, what really encouraged me the other time is someone told me like, I had put emergency services numbers, the ones for ambulances on Twitter. It got another 200,000 engagement and views. So someone told me like they posted it into their apartment WhatsApp group, and it was able to help a mother. So I was very delighted when I had that.
Okay.
So I'm really happy when I get positive feedback. Actually, that what I'm doing is making a positive impact in people's lives.
All right. Earlier on, you've mentioned of something that you had to give your statement about CSs. Mothers who undergo CSs. Let's talk about misinformation there a bit. How does someone now, when I get online and see Dr. Austin Omondi, maybe next week I come and find Dr. Okeze. How then do I get to trust that, Dr. Okeze is actually not someone I should listen to? I really need to listen to Dr. Austin because he has the correct and verifiable information.
That's a very important question. As with social media, your safety is equally in your own hands. You can actually have to take time and investigate and look at who exactly are you following. Sometimes you might be following a quack. So the beauty of it is that the KMPDC has an online portal where you can just search the name of the doctor and can able to give you like verifiable results. For example, if you search Dr. Okeze and is not there, you can be sure that Dr. Okeze is not trusted medical doctor. Right. And then also based on where a doctor works, I think it's a very small country. If you ask around, you'll be able to find out.
Right. So you can know, Dr. Austin Omondi, where did he go to school? It's easy to source that kind of information, right?
Yes.
Now, how do we make healthcare affordable in the Republic, Dr. Austin?
So that is you've gone into the geopolitical side of it, and I love it. As an aspiring health, yes, one day. I love it. So I think the current government is doing so much on UHC and basically making health and AFIA affordable to basically all Kenyans. So at the moment we have, I think the government does subsidize a lot. Particularly, we used to have initially the Linda Mama program where mothers will be able to deliver for free, and I think it's very useful. Things like TB medications, they're normally very expensive, to the tune almost of 1 million shillings, but we get them for free.
In Kenya,
In Kenya, yes. Things like ARVs also given for free. So I think the government is really pushing that. And then also with the NHIF. So for the viewers at home, I'd really like to encourage everybody else, particularly right now with the lifestyle diseases and with an aging population, please just get the dialysis cover. It really saves a lot of lives. So because right now kidney diseases are on the rise, cardiovascular diseases are on the rise, hypertension is on the rise. So the NHIF cover does really help currently in the world. So as we push towards UHC, I can see also the health CS. I normally follow her tweets very closely, Honorable Nakumicha. So if you're listening at home, I think I'd like to commend you for that. So she really does help us a lot in terms of donor funding, and also just making our issues known to the World Health Organization at large. So
Right.
she's really doing a good job.
Okay.
Kudos to her.
All right, that is kudos to the health CS. But then I'm going to introduce a very tiny caveat there.
Yeah.
The current state of affairs of healthcare in the country. I've seen you also being very vocal about it in regards to unposted 4,000 unemployed doctors. What is happening there, and what is the challenge the government is facing in? I thought this is just a letter and report to work the next day.
No, initially it used to be like that, but changing times and tough economic times have also plagued us currently in the country. So right now we have unposted interns, we have unpaid interns who joined in January 16th, and we also have right now we have around 4,000 unemployed doctors. So it's currently a very big problem. But recently, I think 2 months ago, the president spoke about it. He spoke about the spoke and wheel kind of method, where he was going to employ like all the 4,000 doctors, clinical officers, and nurses, and community healthcare workers. So I think I'm a firm believer of our president. I think he's a very smart man, and I believe I took time and read about the model, and I think he promised us within 6 months to 1 year that there will be positive steps in that direction. So I'm really waiting for it, like very patiently, and also putting a lot of trust in that. Then recently our health CS spoke about the posting of clinical officers and nurses. So I also thought it was a very positive thing.
Right. But this conversation has gotten to the highest of
to the
ranks.
highest echelons. Yeah.
Okay.
So yeah.
That is good to see. And I did also see reports that the president said the NHIF cover will be reduced, the monthly remittances from 500 to 300, and that is by the end of 2023, hopefully also covering cancer treatment. So as Doc has said, please, if you can get NHIF, do get it. It really is helpful. Maybe as we wrap up, I think we'll wrap up from you as an online medic. Currently that's the status that you are holding on the interwebs. A message to your followers. But before we switch to that, you also do something else. When I scroll through your timeline, I meet images of very nice looking interiors that I wish for my house, but I don't know if I can afford that at the moment. Tell us a little bit about this. You're also an interior designer?
I'm very passionate about that. So we were able to do something with my friend called Caleb. He's actually the founder of the company. It's called Mbunifu Interior. So check it out on Instagram, check it out on Twitter, and I believe you're going to also be on TikTok very soon. So Mbunifu Interiors is something I do on the side. I'm also very, very passionate about it because interior also and design has an effect on mood and also on health. Because when you walk into a hospital that has red colors, very scary things,
shouting colors, you're feeling very unsettled.
It really affects your mood. So also with a good interior and whatnot, it also affects like the way people respond to the spaces and whatnot.
Right.
Also very therapeutic. So we've done a couple of designs. We design clinics, we design houses, we do coffee houses, we do like hotels, restaurants, and also bars. So if you do have time, you can also check us out.
Yeah, the images are there, very beautiful ones on the screen already being displayed.
Amazing.
Yeah, so check out
Mbunifu Interiors.
All right.
Yes.
Mbunifu Interiors. Sasa nishajua what's the problem with my anger issues. My house isn't set for the mood.
I think that's the major problem. So give me a call, Richard. I'd love to work on your house.
Okay, sure thing. Please do talk to Japrado, and he will direct you to the necessary resources to boost up your interiors, whether hospital, coffee shops, or even your house. Finally, Dr. Austin Omondi, speak to your current thousands of followers and also future followers as well, and also the importance of maybe the journey that online medicine has been taking so far.
Okay, so thank you once again, Richard, and KUTV for this amazing opportunity. It's also a very humbling experience for everyone who's trying to build an online presence. Just start slow, start small, be very consistent. I think that one has really helped me, like a tweet a day, 2 tweets a day, and also like talk about like whatever is happening in the country. Look for a niche basically for what is happening. For example, talk about cancer, talk about hypertension. There are so many developing problems. And also thank you for my followers, because 16,000 is a huge number. I would not have dreamed of having such a following online. So I do also have a segment on Saturdays called a Q&A session, which I normally like put out. We talk about diseases basically and the management. And I have a team of a couple of doctors which I'd love to give a shout out to. We have someone like Dr. Dama, Dr. Ogera, Dr. Salim, someone like Dr. Andrew Githiria and Dr. Emmanuel Sunda and Emmanuel Chiro. They really help a lot in terms of, we just ask questions. For example, I say, let's ask anything about hypertension today. So we have people asking questions and we just give our medical advice for free, pro bono, you know. And we're lucky, so at the moment we've had like, been able to reach 1 million people throughout the country and answered over 2,000 questions. So that's not a small thing.
That's true.
Yeah,
That's
so I'm actually
true.
very humble. So I'm also encouraging other doctors out there, like let's push online and let's make medicine great again.
Right.
Yeah.
That is, let's make medicine great again. All right, I was trying to look for the abbreviation there, but I couldn't get it. Whether it's MAMA or MAGA, but thank you very much, Dr. Austin.
Thank you so much, Richard, for having me.
All right.
Amazing.
Biashara Tuesday takes a break. I'll be reading your feedback here already. People commenting. I see Dr. Ray Lubega saying, good work, Doc. We are following. And we're coming back also to see more of that feedback on Facebook, Twitter, and also where we are streaming live on YouTube at KUTV Kenya Live. Don't go too far. I'm just going to take a cup of water and then I'll be back.